Hi, my name is Victoria Fulford. I'm with Mumlicka Healthcare. We're here today to talk about the Mepilex border sacrum dressing. This is a dressing that's currently being utilized for treatment reasons within the facilities. However, this will now be taking a prevention strategy. So this dressing has been approved for just to begin with the CV ICU patients and the CVOR. Once that has been implemented, we will be moving on to other units. So right now it just applies to this. The reason this dressing was chosen from a prophylactic reason is that the MPOP guidelines state the use of a 5-layer dressing helps to reduce the incidence for pressure injury. The way that this dressing works is, as I mentioned, this is a 5-layer dressing. So when it's on the patient, what happens is this dressing will take the majority of the friction and shear instead of the patient's skin. It's going to help redistribute the pressure as well as negate the friction and shear. So when we're applying this dressing, we're going to want to make sure that we apply it first to clean, dry skin. No lotions or potions on it. Make sure to dry after you're cleaning it. The dressing can go either way. It can go up or down. There's no right way to do it, but it's important that we know where the placement of the dressing is. So in order to find out where our sacrum is, you put your hand on your hips and you go around to the back, have 3 finger breaths, and that's exactly where your sacrum and coccyx is located. So just making sure that you're not putting it too high up or else it won't provide the appropriate protection. Another thing to note when we're using this, doesn't matter which way we go, but when we are removing the middle backing of this, it's important that we get a very good seal so it doesn't tent. I'll go a little bit closer. As you can see right now, our dressing is tenting and it has a chance to get stool inside of it. However, if we make sure to get it right in the gluteal fold, now you can see that the dressing moves with the patient and it's going to have less of a chance to get any stool underneath it. One other thing to note before we start is that I've shown on this dressing here, it is labeled P for prevention. It has a date and my initials. This is important just so the wound care team knows that when they're coming along, this is not for treatment, this is specifically for prevention purposes. So as we begin, we're gonna fold it like a taco, that's what we always say, and we're gonna make sure that we get as good of a seal in this gluteal crack right here. So we're gonna start by pushing in, and then we're going to smooth out so we can get a good securement. If you need help, if your patient's able to do this, sometimes lifting their leg can allow to get a better seal in that fold as well. So that's another little tip that you can use. Now we'll remove the full backing sheet here. As I said, we gotta give it a little love to make sure all the silicone is touching it. Then we'll remove our side films. It's important that we pull upward towards the head. And again, this ensures that if there are any creases, it's gonna make sure that the stool doesn't get inside of there. So I'm pulling off my release film from this side, pulling it from this side, again making sure that we are pressing the dressing down to ensure a good seal. Now you can see our patient is protected, and that's my presentation. Thank you.